I wanted to open with a little brief thing. The topic is stress, and that is such a massive term that we could talk for a week on this, not an hour. So I want everybody to understand we're really consolidating a lot. And I know Dr. Mike has a couple of books to reference. I do as well. One that I'm going to hold up right now, Why Zebras Don't Get Ulcers, by Dr. Robert Sapolsky. He's a biology and neurology professor at Stanford, a small school you might have heard of. And I just want to read actually a tiny little excerpt of that, because I think it's going to help us understand once again why this is such a critical topic for us, okay? And he says, our current patterns of disease would be unrecognizable to our great-grandparents, or for that matter, to most mammals. Put succinctly, we get different diseases and are likely to die in different ways from most of our ancestors, or from most humans currently living in the less privileged areas of this planet. Our nights are filled with worries about a different class of diseases. We are now living well enough and long enough to slowly fall apart. The diseases that plague us now are ones of slow accumulation of damage: heart disease, cancer, cerebrovascular disorders. While none of these diseases is particularly pleasant, they certainly mark a big improvement over succumbing at age 20 after a week of sepsis or dengue fever. Along with this relatively recent shift in the patterns of disease have come changes in the way we perceive the disease process. We have come to recognize the vastly complex intertwining of our biology and our emotions, the endless ways in which our personalities, feelings, and thoughts both reflect and influence the events in our bodies. One of the most interesting manifestations of this recognition is understanding that extreme emotional disturbances can adversely affect us. Put in the parlance with which we have grown familiar, stress can make us sick. And the critical shift in medicine has been the recognition that many of the damaging diseases of slow accumulation can be either caused or made far worse by stress. The floor is yours, Doc.
Joe, shit. I don't know how to. I can't top that. That's a statement, and just like you're saying, it has so many ramifications. So let's do a couple of things. Number one is we wanted to bring this topic to light a little bit because of the thing that we've been harping on for 6 weeks now, that there is a pandemic. I'm sure everybody's tired of hearing that word out there, but there is a pandemic of not just this coronavirus, but there's also a pandemic of fear, and that pandemic of fear correlates to how our bodies handle stress. Okay. Now, stress comes in a lot of different forms, like Kevin was just Dr. Kevin was just talking about. You have physiologic stress, you have non-physiologic stress, which some people will call more chronic stress, and that may be the emotional components of things too. And then there's also oxidative stress, which is more of a cellular level, and that's why Dr. Kevin was saying this could be a topic that easily medical schools can go for a whole week on topping these kinds of things. So let's just kind of break it down a little bit. And it's important for us right now because of what we're going through, and also helping us to be able to handle it. So understanding the basic physiology helps us a little bit with understanding our bodies, but also then getting to the point where how do you yourself handle that, or I'll say the word treat that, or how do we cope with handling our body's natural stress responses? Okay. Now, obviously there's a lot of numbers out there with COVID, et cetera. And all I'm going to say today with regards to COVID is we talked a little bit the last couple of weeks about how that virus affects the body at a cellular level, and that's that oxidative stress. So basically, when your body gets oxygen into it, oxygen molecule gets reduced by adding an electron, and it forms a free radical called superoxide. and it's part of these reactive oxygen species that can start to affect our body in a lot of other ways. So at a cellular level, if you don't have your zinc, if you don't have your manganese, if you don't have your glutathione, all the things that we've talked about with regards to supplements, the enzyme that helps to further reduce that superoxide is called superoxide dismutase, and that doesn't work. So you end up with these free radicals that start to, number one, break down the endothelial lining of the blood vessels. And that's why you're seeing all these stories and reports of people having COVID toes and also blood vessel clots and strokes. So working on that stress component is very important, even in trying to handle these viruses. Not only that, but like we talked a little bit about, the virus attacks a specific receptor called the ACE2 receptor. And when that happens, that prevents you from metabolizing angiotensin 2, which constricts the blood vessels, etc. And that has an iron mediation. So these are the things why it's so important that nutrients and our supplements and things like that are so vital for us at a cellular level. And then there's the points that we're going to talk about right now at more of the organism level, the human level, okay? So you got to remember that stress is actually a good thing, okay? It's very protective for the organism. And there's both pleasurable stress, okay? I'm in line, I'm going to ride Magnum roller coaster and I can't wait and my heart rate's going up, and you know that that's stressful, but it's actually a good stress. And then, of course, there's the stress where, way back when, we saw the Roman army coming at us and, oh my God, here, what's going on? My heart's going up, etc. So stress serves a lot of purposes in inside the body for protective mechanisms. Unfortunately, when that stress gets prolonged, you get an imbalance of everything, and that's when the end organs start to get affected, and you start to fall into disease patterns like Kevin was talking about in that excerpt from the book. So at a basic level, okay, you get some sort of a stimulus, whatever that stimulus may be, like we were just talking about, some of them good or bad. And there's an area in your hypothalamus just underneath called the amygdala, part of your brain, that recognizes this stimulus and immediately sends a message to the hypothalamus to start off the whole trigger with stress, okay? Basically, I'll start with the neurologic component, because then there's also an endocrine system component to it too. But the easiest one to start off with is a very quick one, and it's almost like a reflex, okay? So today, just as an example, I'm outside in the yard and I'm picking up sticks from the yard, and all of a sudden I go to pick up a stick and I retract quickly, and luckily I did, because it turned out that it was a snake, okay? But even before my brain recognized it as a snake, okay, I was able to pull back quickly. So that stress reflex very quickly went down those nerve fibers and helped to protect me so I didn't get bitten by that snake. Even faster than your visual cues to actually pick up and see that type of thing. So what that did is sort of a neurologic quick reflex from the hypothalamus through the dorsal root ganglia inside the back, which is part of the sympathetic nervous system. So the hypothalamus has a link to something called the autonomic nervous system. And the autonomic nervous system breaks down into two components. There is a central nervous system component of the sympathetic nervous system that has to do with norepinephrine, and Kevin may talk a little bit about that. And then there's also the peripheral parts, which are the sympathetic nervous system and the parasympathetic nervous system. So we've all heard the term fight or flight, okay? And fight or flight has a lot to do with, well, not has a lot to do, it's the sympathetic nervous system and what they call sympathetic tone, what your body is going to respond to in a stressful situation. The parasympathetic nervous system is that sort of, I think they call it rest and digest. So that's sort of the opposite. So there's this balance between the two things, okay? Eastern philosophy, the yin and the yang, okay? The balance with everything inside the body. So the sympathetic nervous system gets triggered by the hypothalamus, sends that signal down to the dorsal root ganglia, down to the nerve fibers, and then those nerve fibers go and they connect into the adrenal gland. And in this component, the adrenal gland, the middle part of the adrenal gland is called the medulla. And the medullary component of the adrenal gland is where you get what we colloquially call adrenaline. Well, in medicine, we call it epinephrine. And that epinephrine is basically the mediator for the sympathetic nervous system. So it gets released into the bloodstream very rapidly. And then when you get epinephrine surge inside your body, that's when your heart rate goes up, your blood pressure goes up, your cardiac output's increased, your pupils dilate, your muscles contract. You just get everything kind of going all at once. And that's what they're talking about with the fight or flight. Your colon slows down. You don't want to be your appetite decreases. So there's all these other factors. And then, of course, it also causes your lungs to start breathing more rapidly, and also dilates the blood vessels. And anybody who is aware of something we used to have over the counter, believe it or not, over the counter was something called Primatene Mist, right? So Primatene Mist was something we used to give to asthmatic patients, but it was over the counter. Well, believe it or not, that was really nothing more than epinephrine, okay? And that would stimulate everybody to open up their airways and help them breathe better, but really was also then triggering a whole sympathetic nervous system cascade. And so eventually they took that off the market. Big surprise. Can't believe it was on there in the first place, but either which way. So you've got the sympathetic nervous system doing all this. And then you also have the hypothalamus now going back up to the brain. It has now got time to start to trigger the HPA axis, or what they call the endocrine, the neuroendocrine component of stress. So when you get that guy going, so the hypothalamus sends a releasing hormone a releasing factor to the pituitary gland. The pituitary gland then gets stimulated and it releases a hormone called ACTH, which then goes down, which is adrenocorticotropin stimulating hormone. And basically, that's now going to get to the outer component of that adrenal gland. Such an important gland, that adrenal gland. It has essentially 4 layers. It has 3 cortical layers and then the medullary layer. And the outer cortical layer has your body's own natural glucocorticoids, or cortisol, okay? It also has a hormone called aldosterone, and it also has an area for sex steroids. So your testosterone and some estrogens, etc., are also made inside there too. So the pituitary gland says, all right, adrenal gland, you need to do something more. Now you're not just going to be secreting out that epinephrine. Now you're going to start pumping out a bunch of cortisol, and that cortisol gets into your body, starts to get things going. It goes to the liver, and it tells the liver to start getting the, along with epinephrine, tells the liver to start breaking down the glycogen stores and start making sugar for your body to start feeding all this kind of stuff, and break down lipids and fats, etc., so that then you've got this energy to get things going for the muscles to contract and etc. And it's when the cortisol continues to get stimulated over time into what Kevin's going to talk, I'm sure, about it, is other end organs from having hypercortisol for longer time periods, and how that has a negative effect after a long time. But in that immediate effect and that immediate stress response effect, it's actually helping to feed and co-work with the epinephrine, the sympathetic nervous system, etc., to be protective to the host, so protective to the biological organism. Okay, so those are really sort of, I'll stop there, because that's really sort of the basics with regards to sympathetic nervous system, HPA axis component of it. The thyroid gets played into there because there's a negative effect on the TSH gets suppressed because of a negative feedback loop with the whole thing. So since we were talking about thyroid last time, there's issues with that, but that comes up more with that chronic stress related type situation. And so the excess cortisol is one of the biggest problems and the end results of those things with the chronic stress. But you always want to be protected with regards to some other stimuli, and that's really what the basis of this is. And then you guys can expand on more too.
Yeah, no, I think that's good. I mean, that idea of there's good stress and bad stress, eustress, distress.
Yeah.
And kind of figure out which one is which on that.
Acute versus chronic, kind of understanding acute stress is fight or flight. You want to get out of there, get out of that situation. That's an acute stress. Chronic is when the stress response is happening day after day, hour after hour for a long period of time.
And that's really where a lot of that organ damage and some of the other kind of significant health diminishing aspects come into play. And so I'm going to expand on that a little bit here, but if you think about it, I'm going to pull from just an example here. So if you're sitting there in the safari in Africa and you're dealing with a bacterial infection because you drank some water that you shouldn't have, that's a stress on your body, and it's working on that. However, what happens if, outside that tent, you all of a sudden hear a lion? Your body's going to do a few specific things. And one of the things is it's going to start to not really care too much about the bacterial infection that you might be fighting. And it's going to try to figure out, okay, how on earth do I mobilize the person to get you out of that dangerous situation? Because certain stresses are going to trump other stresses in the body. And I'm talking about the immune system here for a second, because with chronic stress, immune system becomes suppressed, period. And I think that should be a pretty concerning thing to a majority of Americans, I'm going to say, because most of us are dealing with heightened levels of stress over a consistent period of time than what we were ever designed to be functioning with. And so, the immune system being activated or turned on, if you think about it, it's a very, very energy intensive process. If you've had the flu before, you know how energy intensive it is because you are incredibly weak during that infection. That immune system doing its job is taking a huge amount of the cellular energy in order to run and do its job. So when we talked about that fight or flight, rest and digest, like that parasympathetic state, the state where, our stressors are maybe at a lower point and we're calm, we're relaxed, we're settling back down into that spot. That's where our body is going to be able to heal and utilize other things more effectively. So under stress, bottom line, the immune system becomes deactivated in order to conserve energy to allow your body to try to get out of the stressful situations. And one thing that you might even see on lab work with that is that secretory IgA levels can be low. And that can be a big indicator of perhaps some chronic stressors that your body is dealing with. And there's other ways. I'm going to kind of intermix at a couple of different points here, but there's ways of starting to test and get an idea of how your body's actually doing, how well that adrenal gland, they're little walnut-sized glands sitting on top of your kidney. So you've got two of them, but as Dr. Mike was saying, they're producing different hormones, and one of the main hormones is cortisol for dealing with that stress response, and especially in a chronic stress position, that cortisol output starts to become really, really problematic for the body. And one way that you might see this is if you know anybody who's been on glucocorticoids or something like prednisone for long periods of time at moderate to higher doses for specific conditions, they're going to be dealing with some health complications as a result of that. And Dr. Mike can speak even more to that, I'm sure. Do you want to chime in now on that, Doc?
Yeah, prednisone is another one of these good and bad things. It's great if you can use it on a short-term basis. It's terrible when you have to use it on a long-term basis. There's a syndrome called Cushing's disease and Cushing's syndrome that essentially is one of the ways that if you've ever heard of it, you'll understand. But when you're on prednisone long-term, and that's typically more than 2 weeks at a time, you get a negative feedback loop. So you actually now start to suppress your own adrenal function. So then your adrenal gland slows down and shuts down. Cortisone, or I'll say prednisone in this circumstance. There are other ones. There's Medrol and all this, but any of those over time have the ability to start making your sugars rise. So you start to become almost diabetic in a sense, which everybody knows already now. That's a big risk factor because it has an immunocompromised state. And it has a lot to do with the endothelial damage at that cellular level that I was talking about, with not being able to handle free radicals. Same thing with long-term prednisone. You're going to start to put on excess weight. You're going to make your blood pressure go up because you're holding on to excess fluid. Prednisone is not really discrete, so it has a little bit of an effect on the other hormones in the outer adrenal cortex as well. So the aldosterone that we talked about, which has a lot to do with sodium retention inside the body, so your blood pressure goes up, and like you're saying, Kevin, it is an immunosuppressive medicine after you've been on it for a while. And sometimes that's good, because in the acute phase, if you're using it short term, it's to knock down inflammation. So it's suppressing that inflammatory response in the event of an acute injury or acute disease. But once you go on it for a long term, now you're actually starting to affect all the other good and immunological inflammatory responses that you need to have to fight off disease. So it is an immunosuppressant long term. Yeah. Well, that was long. Sorry, that was long.
No. But I mean, I think a clear way that we can see just how effective medications are like that at helping to suppress immune function is when you look at organ transplants, right? You know, anybody who receives an organ transplant has ended up getting put on some steroid therapy as well. And that's partially, there's lots and lots of meds that people get put on to help with rejection, but that's one component that goes with that, and obviously helping with inflammatory responses, etc. But you know, one of the things with that low Sig-A as well that I was talking about, if we have this lowered immune response, that's going to increase our susceptibility to foreign invaders, various pathogens, whether that's bacterial, viral, parasitic, fungal, etc., and also make us more prone to different food intolerances, chemical intolerances, etc. And that is going to drive further disease processes and further end organ damage, whether that now be our gut, our brain, etc. And so when it comes to heightened stress hormones being produced and present in the body, we see a significant impact on the brain. MRIs show cortical atrophy. We see a shrinking of the brain. We see impacts on the midbrain. And one thing that we can think about, the forebrain, which is where our logic and reasoning and really our conscious thought comes from, becomes suppressed. And we revert more towards like a subconscious, not hindbrain sort of thing. And there's less mental clarity as a result of that. And if you think about it, once again, if we go back to the lion is standing outside your tent, you want to be kind of reflexive. Like our forebrain with our logic and reason and conscious thought it's a slower process. It's slower to draw off of for decision making and things of that nature. Our subconscious, there's a lot more neurons that are working on that one. And, you know, you're not sitting there thinking about making your heart beat right now, or how many breaths you're taking, or what your kidneys and, you know, little nephrons are doing to filter your blood right now. These are all subconscious pieces, and reflexively, our body is going to revert back to that subconscious mind to make a decision of, do I need to run? Do I need to fight this thing? How do I hide somewhere? What do I do? But there's less logic, there's less reason, and there's less mental clarity that's going into that, because a more primal, reflexive portion of your brain takes over in that stress spot. Chronically being put into that spot, you know, one thing that people talk about frequently is, hey, I've got brain fog. I just don't feel like I'm as sharp, I'm as clear, things aren't clicking as well. I don't seem to be remembering those names and dates the way I used to, or the words on the tip of my tongue, and I can't get it out. It's right there, and I just can't think of it. And maybe it's a little bit slower. Maybe you're not noticing it, but your spouse is, or some other ones are. It can be an indication of some of that, and partially that cortical atrophy, because your brain is being impacted by these chemicals that your body is meant to produce. It's just being produced in excessive amounts. So that's something to be thinking of there, as your brain is literally shunting blood from one portion to another in a chronic nature. And Dr. Ash is going to talk a little bit about this too, but I'll feed a little bit into this because I'm going to bounce around a little bit. But neuroplasticity, if you're constantly in a stress spot, guess what? You're going to be forging down that trail and making new trails in your brain in a big way. So I don't want to steal anything from what you're going to talk about, but
no, we can jump into it now. I mean, really, the whole idea and concept of neuroplasticity is the brain can change, and really that can be wonderful news, especially if you have some sort of brain degeneration or negative brain pathways. But it's not so great now if we're talking about stress and reinforcing the stress pathways. And pretty much what happens in plasticity is, you know, the brain circuits that you are using constantly really get forged in. So if you are, you know, succumbing to this chronic stress response and stress state, your brain is going to be more conditioned with those stress pathways to continue down that road. And so it's going to be, you know, more of a just diverted, like that's what your body does if you're hit with a stressor. But on the flip side, it's good to know about that, because if you are thinking of, you know, something positive, if a stressor is coming at you, you have the ability to rewire those pathways into a new pathway and shunt your brain energy into a new pathway that's going to be more positive for your body. And hopefully the whole, you know, endocrine cascade, you can shunt that and stop that by reinforcing that positive neuroplasticity. And we'll talk about some other strategies here, but I think this is a really key concept because, you know, we'll talk about, you know, all these choices that we can make to mitigate the stress response, but remembering is the first thing. Because how quickly, especially if we're in the neuroplastic state, if we're just going to go straight to stress, how quickly that it's instinctive. It's almost reflex, because our brain has done that for so long. And especially us Americans in this fast-paced go culture, you know, we have to be productive. We have to be on time. We have to do it all. That's not setting ourselves up for healthy brain, healthy stress response, and healthy neuroplasticity. So
yeah, so we'll get into a bunch of different strategies, but I didn't want to take her neuroplasticity piece, but with the brain. But, you know, one of the other pieces that I want to talk about when it comes to stress response has to do with that, with the digestive system. And, you know, one thing that I hear all of the time is about reflux, heartburn, and the need for acid suppressants and PPIs, things of that nature. And I think while those things may have a place at points, most instances of hypochlorhydria or low stomach acid production, I would argue, tends to be because of the decreased production naturally within the body due to chronically elevated stress levels. We know that when stress is high, we are not producing as much stomach acid to break down our foods. Well, this has big implications as well, because that's impacting not just our digestion, but then ultimately our absorption of nutrients as well, so that our body can heal and recover from whatever it might be dealing with. So if we have low stomach acid, our food is going to just tend to sit in our gut. And when it's just sitting there, it hasn't been able to stimulate peristalsis, or the movement of food throughout the digestive system. And so it's kind of sitting there almost putrefying, if you will, in the stomach. And it will ultimately then reflux back up, coming back up through little muscular junction here, and where it's coming through the diaphragm. And now you have burning, or you might have those barf burps or things of that nature, where you're almost kind of regurgitating food. And, it's an acid in the wrong place problem. It's generally not a too much acid problem. I think it's pretty rare. That's why so many people actually might find benefit and relief from actually taking apple cider vinegar shots, or doing some other digestive enzymes, or some other supplements with like hydrochloric acid or HCl to actually increase stomach acid and the body's ability to break down that food. And then oftentimes they're able to come off of medications like PPIs, your Prilosec and omeprazole and all the other, acid suppressing medications, and allowing digestion to occur properly, so that peristalsis, or the movement of food throughout the gut, is happening well. Motility, or that movement through peristalsis, kind of interchangeable terms in a lot of ways, is significantly impacted. And a lot of that is being mediated by the vagal nerve, and then the enteric nervous system. We've got a whole network of nerves in our guts. And that's why, like, hey, I'm nervous and I've got butterflies in my stomach. Why? Because we've got a second brain here in our stomach, in our abdominal cavity, that is controlling a tremendous amount. I mean, we've got almost as many neurons or nerve cells here as we do here. So they're connected, these two brains. And one of the big ways that they are connected is the vagus nerve, or one of the cranial nerves, coming out kind of base of the skull, traveling down and innervating everything from heart, lungs, intestines, etc. And that vagus nerve is a parasympathetic nerve. It's part of that rest and digest, that autonomic, I'm not thinking about what it's doing portion of the nervous system. And that vagal tone, the vagus nerve, the parasympathetic tone, can really be decreased and be overridden by the sympathetic nervous system due to this chronic stress exposure that we're in. And so we can have all sorts of changes in our digestion, and how well we're absorbing and even breaking down the foods that we're consuming, which obviously has a big deal. We hear all about various nutrient deficiencies. We hear all about leaky gut. We hear all about tons of other, frankly, digestive issues in this country. I mean, normal bowel movements, it's 1 to 3 a day. And we're not talking just a little bit. We're talking a significant volume. And when I look at my intake forms at the office, people are not digesting. And, bowels are not moving properly. And the amount of gastrointestinal disease that we're seeing is skyrocketing right now. And a portion of that is due to I really believe some of this chronic stress response that our bodies are dealing with. And so we're having things get through that never should. One of the things that I should mention as well that's really important for HCl, or that stomach acid that's being produced, is to kill off pathogens. We've talked about in other lectures, like, you're not eating sterile food. There's bugs and bacteria and stuff on that, and that's good. It's okay. It's how our bodies build an actual immune system. We can't live in a sterile environment. It doesn't work. You've seen lots of doctors kind of, this is controversial, but talk about, hey, maybe this lockdown wasn't the right thing. Look at Sweden. They're doing just fine. They didn't do a lockdown. We can debate that at another time, but I think that it's one of those things where our body needs to be exposed to certain amounts of pathogens in order for our body to have an immune response, but we don't want too many either. And that's where that HCl can be a helpful piece to kill off some of the things that we are being exposed to in our environment. So, I want to make sure that we leave enough time for questions, and I want to spend some time talking about different strategies for modulating that stress response right now. We could, as I said, we could go on and on about different tissues and organs that are impacted by stress. Ash, Mike, did you guys have any other organs that you wanted to hit?
No, I think what you just said was one of the key things, and the interesting thing, like you're talking about, is that balance between the two. And there's no doubt that the dysmotility, the lack of motility in the GI tract when somebody is under chronic stress, is a huge piece of it. So things slow down, like you're saying. There's even people talk about hiatal hernias, etc. Yep. And so everything backing up. Not to mention, with the chronic stress, the higher levels of cortisol then start to create more central obesity. So then you start having excess weight around your waistline, which then pushes an extraneous pressures. Anybody, not me, but anybody who's been pregnant knows what it's like when you have that extra pressure pushing up and getting all that heartburn. It's just because things are not moving as well. You're getting extra pressure on things, etc. And obviously that's a different physiology, but it's the same kind of thing when you have too much weight and the motility is reduced. Absolutely, hydrochloric acid is necessary. I mean, half of the reason why you get postnasal drip is because all those bugs and pollens and things like that get trapped in the mucus of the nose. You swallow it intentionally, and that's so that the hydrochloric acid can break down all those proteins. And without that hydrochloric acid, all those basic protein molecule allergens, pathogens, bacteria, etc., are going to start to build up. So I think that was a great point for you to make sure that we all know. And like you said, having that stress level gives you the butterflies in the stomach. Well, that's more of that acute kind of situation. More chronically, when your cortisol levels are going up long term, and even with people that are on prednisone, know what we just talked about. Now, after a while, you start to get into what they call stress eating, okay? And so the higher levels of cortisol and all that kind of thing start to stimulate satiety receptors inside the brain and say, okay, I got to start eating more and more, and it becomes a vicious cycle with too much sugar and then all the other things that we've talked about as well before too. So, it's a tough one, but it's ubiquitous, and everybody has to deal with that. And the people that are most affected by these types of things tend to be the people with diabetes, tend to be the people with cardiovascular diseases. And they're the ones that also can't fight those free radical oxidative stressors at the cellular level, just like what you're talking about. So, so we got to work on how to deal with it. That's really big ones. And, what we always talk about is the less medicine, the better. So, there's plenty of interesting ways that we can talk about, tools, so to speak. And, you can break that down into, social support systems, physical activity, and obviously the mental things with meditation and relaxation techniques, etc. So maybe you guys can talk about that.
Yeah.
Well, I think first and foremost, discussing breathing is super important. And the reality is, again, in our culture, we tend to, do these really short chest breaths because we're stressed out and because we're not mindful of our breath, and it's super easy to, or we hold it if we're stressed. But we really need to be kind of aware of the diaphragm. This is like a dome-shaped musculature here that helps our lungs move in and out, but like releasing and
The dog's at her
calming.
feet. She can't move. Oh, buddy.
Being mindful of the diaphragm. So first of all, again, at least maybe for women, but probably all of us, we also have a very sort of fat phobic and very we have to look a certain way. So we want to stay tight and tucked in, and that tightens our diaphragm, and we don't want to let our bellies out and breathe from our belly. So first and foremost, we need to be breathing. And this is like the easiest and the hardest thing at the same time. It's the easiest because it's free and you can do it anywhere, but it's the hardest because you forget. It's almost impossible to remember. So it's impossible to not achieve a physiological benefit when you are taking part in a deep breathing practice. So this most simple way to do it is to just take 6 deep belly breaths. So your belly is moving out, your diaphragm is nice and relaxed. Sometimes I even tell people this before a meal. Again, if they're having any digestive issues, digestion is a top-down process. I think it even starts with your brain, coming to the table, taking some deep breaths, expressing some gratitude for the meal, but making sure that you are not in this sympathetic state, but bringing yourself into the parasympathetic. So I always tell people, even you have to hold it to kind of get a little bit of a stretch in your diaphragm. So there's not lots of good room for digestion there, but breathing. So either when you come to your meal or you're feeling an outside stressor, or just make it a part of your routine in the morning and midday and night. But if you do 6 breaths is enough to totally shift sort of these endocrine, these stress hormone systems that we've been talking about tonight. So in through your nose, out through your mouth 6 times, deep belly breathing. That's probably your most simple one. But there's also other ones. We just did a YouTube video on the alternate nostril breathing, so I won't give those instructions here, but you can check out Kevin doing the YouTube. But again, really increasing your sympathetic tone. You want your rest and digest to be toned and on fire. And then 4-7-8 breathing is the last kind of breathing I'm going to talk about. And this is super helpful to even calm down further. My people that have a hard time sleeping, I typically mention this one in particular. So you're going to breathe in and hold, again, belly breath, but hold 1, 2, 3, 4. You're breathing in 1, 2, 3, 4 on the count of 1, 2, 3, 4. You hold for 1, 2, 3, 4, 5, 6, 7. So 4, 7, and you're exhaling for 8. Doing the cycles of the 4, 7, 8 breathing, again, is really going to shift you in your physiology and probably bring you into an even more restful spot than just your typical deep breathing. But again, guys, just even set a timer on your phone, or carve out that time so you're not forgetting it. And like we talked about neuroplasticity, this is like so intertwined here because it's going to help train your brain to press pause or not go through that inflammatory stress cascade.
Ashley, can I interject real quick, Ashley? Sorry, I think that's awesome, and I think those breathing techniques are great. The other thing that I would just encourage is the key is that you're trying to take volitional control over an automatic function. So a lot of times I'll tell my patients, when you're getting up in the morning and you're brushing your teeth and you're standing up at the sink, so you're thinking about brushing your teeth, then you can stop and do that breathing, because your lungs actually do work better when you're upright. Your lungs are kind of like a slinky, and if you have a slinky down on one side, it condenses, but if a slinky is stretched out, you've got a lot more surface area. You get a lot more oxygen. You get a lot more movement to everything. And like you're saying, it allows the diaphragm to drop. When the diaphragm contracts, it drops. So that helps to open up and it draws air into the lungs. So just it's nice to do it in that circumstance, because then you're taking volitional, like Kevin was talking about the forebrain. You're taking that part of the brain and having it override those automatic systems underneath. So that's all.
Yeah, and it also just helps you release like feel good neurotransmitters like serotonin, and dopamine. So kind of along that same vein, we'll talk about exercise, and obviously exercise is going to boost endorphins, which are feel good chemicals. It also releases brain derived neurotrophic factor, BDNF. Again, it's going to act on the opiate receptors in the brain. So again, feel good. You're going to exercise it can fall into the stress category, but also in a good way, but really boost your brain chemistry. And again, neuroplasticity. Exercise is fantastic for neuroplasticity. There's wonderful research on high intensity interval training for some of those, brain chemicals. But I would really say like exercise is very individual. And if it's life-giving and fun for you and you're going to do it and stick to it, that's the exercise for you. And it's going to look different for everybody. So, thinking about what kind of exercise is going to, again, be sustainable for you and life-giving and fun. Again, it's just going to, obviously help you with your stress response. I think we did touch on diet and nutrition, but I think it's just important to be mindful that you're getting a good nutrient-dense diet. If you have nutrient deficiencies, if you have some of these pathogens that we've talked about, if you're constantly consuming foods that you are sensitive to, that's going to be inflammatory to your body. All these things are just going to add to your allostatic load, which is really the stress burden on your body. So again, being mindful of those things, eliminating things like gluten and dairy can be life-changing for a lot of people. If you're having a hard time and you feel pretty good, get with one of our doctors and see, do you have nutrient deficiencies? Do you have foods that you're eating frequently that are causing inflammation? Are you getting the good nutrients that you need? Again, some of, even like our neurotransmitters and things that are going to help our brain sort of modulate stress they need raw ingredients to be made from. And if we're not consuming them and digesting them and assimilating them, there's going to be a problem with our brain function and our stress response. So, again, I'd like to also, just as we're talking about nutrition, there's a lot of wonderful supplements and herbs that can really help the body respond to stress well. I'd love to talk about turmeric and resveratrol. Those are really potent anti-inflammatories. So again, stress is inflammatory. We want to always be thinking about how we're bringing the inflammation down. And again, stress really wreaks havoc on our immune system. Well, turmeric and resveratrol are really going to help bolster your immune system, particularly with your T regulatory cells. So those are some of our favorite anti-inflammatory supplements that we use.
They're really synergistic with each other. Resveratrol is a potent antioxidant, but when you combine turmeric with resveratrol, it just amplifies both of them, which they're great by themselves. They're incredible together.
Mm-hmm. And then a class of herbs is called adaptogenic herbs or adaptogens. Maybe you've heard that word. Are really, again, going to help your body respond to stress. A lot of people think that they're like herbs for your adrenal glands, and I think inadvertently they are, but I think of them as brain food. They're going to really nourish and fortify your brain cells, but they're also going to help protect that HPA axis that we talked about, sort of the neuroendocrine system. So again, these herbs are holy basil, ashwagandha, rhodiola, ginseng, and maca. They're all, and there's some more, but those are probably our favorite. And we have lots of different adaptogenic herbs and different products that we use at the office that really can be very helpful for a lot of people. And again, it just helps your body modulate and kind of respond and kind of stay in that homeostasis state in the midst of stress.
Some of those herbs also have a neuro anti-inflammatory impact.
Mm-hmm.
So,
So those were some of our big strategies. Obviously, you know, things like stretching and yoga. Those things are going to be really important. Practicing gratitude, again, such a profound way to totally shift your physiology. So carving out a time for either just sitting and contemplating on what you're grateful for or keeping a journal. Again, consistent practice with gratitude is just going to shift, again, activating, you know, opiate receptors and helping the brain in that way. Feel good neurotransmitters. It's just going to be really a life-giving practice. So, am I forgetting any?
Well, along with the breathing piece, I just want to say, and kind of then thinking about things, meditation can be really powerful. And, you know, that can look really different for different people, but it's kind of just this idea of really calming the brain down. And I'll be quite honest, for me, I'm like, I don't know how to do this. Like, what does that mean? I'm just always thinking about the next thing and what I need to do. I always hear from Ash, like, you've got a to-do list, and it's just always going there. But there's different things out there that exist, and one product that I think is really kind of cool is the Muse device. And it's literally just this headband that goes around, and it's measuring brain waves. Syncs up to an app.
We have the older version.
Yeah, there's a newer version, but it's very cool. But looks great. But it measures brainwave, and so, you know, you sync it up with an app on your phone, and you're listening to someone talk through, and then you're hearing, you know, the birds chirping and the waves gently crashing on the beach, things of that nature.
But it's biofeedback.
Yeah, and so the more birds you start hear chirping, the more calm and relaxed you are. When you hear the thunderstorm rolling in off the beach, your brain is a mess, and you have not calmed down at all. You're not relaxing, you're not turning things off. And so it's a way of actually training and helping to develop some of those neuroplastic changes by giving your body feedback from an auditory standpoint, based off of what your brain waves are actually doing. And relatively speaking, it's a pretty cheap device. It's like $100, $200, something like that. But for what it can do to actually help train your brain, it can be a great, great tool.
I think mindfulness really fits in well. I think mindfulness / prayer, you know, just really grounding yourself, and gratitude kind of goes in there too, but just being mindful. I think we can kind of go about our day with the buzz and the noise and this distraction, but really being, you know, present in the moment, and experiencing, even thinking of your 5 senses. What am I feeling? What am I tasting? What am I smelling? What am I you know, what
feedback is coming into the system.
Is happening. So I actually think that one thing we didn't touch on, but really probably should, is just realizing that we live in a toxic world and a lot of environmental toxins that we're exposed to. We wrote more about this on the blog, but that also contributes to the overall stress burden upon the body. So if you want to hear more about that, you can visit our blog post. And I think, go ahead.
Oh, I just will expound a little bit. Yeah, I mean, I think that it's very important for us, especially now when maybe you have a little bit more time on your hands rather than work on your hands. Some people, is to touch on your spiritual side. You know, prayer, meditation, that is certainly another very positive way for people to handle stressors. Whichever way that works for you, that's great. But, you know, don't forget, you know, unfortunately, when you're under a lot of stress, it has a big effect on your sleep cycle. So allowing yourself to have proper sleep, making sure that and I think that Muse device has a lot to do with that too, I believe. I'm not sure, but, you know, shutting off everything, shutting off all the social media, shutting off the freaking news, shutting off all those other things, so that you allow yourself to have a proper 8 hours of sleep is going to help with the neuroplasticity. It's going to help with regenerating those neurotransmitters that get depleted all day long. And, you know, now we have, like we talked about at the beginning, the whole point of stress and the whole point of the body is to create a homeostasis. So part of homeostasis is that circadian rhythm, okay, that diurnal variation with everything. And when you're under a lot of stress, that what they call the clock system has a lot to do with creating more anxiety. Your inhibitory hormones and neurotransmitters start to kick up more, GABA, etc. And from the medical world, that's where things like Xanax and benzos start to come in, because they're affecting these inhibitory neurotransmitters inside your brain. So sleep is so important, and social supports. Okay, you know, let's not forget, you know, having friends, like you're saying, these positive interactions with people, keeping communication. That's what really is making some of this. Or they call it quarantine brain, or there's a couple of different phrases out there right now, but, you know, not being able to spend time with your friends, not even being able to give your son, daughter a hug when they're coming in to visit you. Or, you know, it's one thing to look at your grandparent through the window. It's another thing to be able to be sitting down with them and being able to human touch someone, and the stimulation and the positive, I'll say, reinforcement, but just the help, the reduction in stress that provides is huge. So, you know, again, you touched on those things, but I just wanted to make sure that, you know, threw that out there. There was a book that was put out not too long ago, and I just wanted to bring it up because I have to say I read it. I thought it was really pretty impressive, and people may know this already. Dan Harris. I don't know if everybody knows the story or who knows who Dan Harris is. He's a news media guy. He's typically on ABC on the weekends. And he's a guy that was under so much stress that he literally had a panic attack on air and just froze, okay? Because he had just let himself go from all this other stuff, and he had a lot of other substances that he was using that he shouldn't have been using. But his book is really all called 10% Happier, and it's really all about how somebody who kind of poo-pooed, because he's, you know, a quote-unquote news media scientist, so he needs to know everything, has to have logical explanations. He talks a lot in the book about how to go through proper mindfulness and meditation in a much more, I'll say, down-to-earth or not so frou-frou-y kind of way. So it just makes a lot more sense for a lay person to be able to read that. But it's actually a pretty good book and a very interesting book, and it kind of blends into a lot of stuff that we've just talked about too.
Yeah, no, it's good. And while we talk about books, so I did mention, like I said, Why Zebras Don't Get Ulcers. If you want to understand the impact of stress on the body and brain in a big way, that's an awesome one for it. The Biology of Belief by Bruce Lipton. Really interesting. What's the subtitle here? Unleashing the Power of Consciousness, Matter, and Miracles. But it's really about how your beliefs, your emotions, what you're thinking about impacts your biology and even your genetic expression. And it's a fascinating read, and really, like, it's one of those ones. He's got a lecture, I think, on basically of him either reading it or giving essentially the book in a lecture format on either Audible or I think on YouTube. And I've probably listened to it like 4 times because I think it definitely has some pretty profound comments about how incredible the brain and what you're believing and thinking and dwelling on is impacting your biology, and, to be honest, your kids' biology and what ends up even happening with them. It's fascinating. And just, we didn't talk probably enough about sleep on this one because cortisol and melatonin are kind of directly in opposition to each other. Cortisol is high in the morning and tapers as the day goes on. You'll see that clearly if you get like an adrenal stress index test or like a 4-point cortisol test. Some even do a 6-point cortisol test.
And we wrote a blog post about it if you want to read more.
But, you know, it's a basic test that, you know, most people don't want to get their blood drawn 4 to 6 times in one day to measure it. But you measure cortisol at one point in the day, it doesn't necessarily tell you a lot. It's a lot more helpful to see what the graph shows as far as the line on that. But getting a test like that, the cortisol tapers as the day goes on. Well, guess what goes up as the day goes on? Melatonin. And so kind of that variant between cortisol and melatonin, that's going to essentially determine how easily you're going to be able to fall asleep and stay asleep. And so we'll talk a little bit probably about sleep next week as well, for sure. When we're talking about EMFs, that's one that I think people are probably like, I'm not going to get on for that one. You want to get on for that one, okay? But Why We Sleep by Dr. Matthew Walker, like this is probably the book on sleep, period. So we'll talk a little bit more about that. He talks about stress some in his book as well, but the EMF topic we're going to discuss next week, that's a big one. So what other...
So we actually had a question that was emailed, and I don't want to neglect that. So the question was, how does stress impact the lymphatic system? And, you know, kind of short answer, you know, when cortisol is high, your lymph tissue begins to atrophy. And so you might ask, you know, what does the lymph system do? Well, it's a delivery channel for nutrients and energy that's going to be dispersed to the cells of our body. It really is a kind of a channel for immune function and significant portion of our detoxification system for our body. So if you think about that, you know, getting your nutrients and energy into your cell, detoxification and immune function, while when we're in a stress state, all those things that the lymph system is going to be involved in are also going to really be suppressed. And you can just see, you know, our ability to detox, our ability to get energy, and our our immune function is all going to be suppressed. So hopefully that answers your question. Are there any other questions about?
Well, the other thing too, it's not just the system. At the cellular level, you got to remember that the stress has a big effect. So the lymph system is, like you're saying, collecting system. It has a lot to do with the liver, the spleen, etc. But the lymph is also a particular white blood cell, and so white blood cells obviously have a lot to do with your immune system, which we all know. Lymphocytes in particular have a lot more to do with antiviral properties. They tend to attack and start to be able to recognize viruses. So guess what? When you have a lot of stress, you tend to get and maybe pick up viruses. I used to always tease people, or teach people, not tease, teach my students that, you know, it was such a common thing in December to have a young college student come in with a sore throat, and you know the infirmary would say, "Oh, you got a virus, you know, go home because you're under stress from finals, etc." And lo and behold, they may end up with mono, etc. So all those viruses tend to be during times like that, and so it does have a big part of it. And as I said at the very beginning, the polymorphonucleocytes and the lymphocytes have a lot to do with breaking down free radicals. That super oxygen, that one molecule that I talked about that was reduced from oxygen, is a free radical, and that's actually one of the things that lymphocytes are able to target with some of their enzymes. So exactly what Dr. Ash was talking about, but also from an oxidative stress cellular level, it has a lot to do there too.
Yeah, absolutely. Thanks for bringing that up.
What other questions I think there's actually one other one here. It says there are some people who get stuck in the stress response cycle or have damage to their sympathetic nervous system and have difficulties manipulating the nervous system back into a more parasympathetic state. What can be done from functional medicine, nutrition, other natural aspects, essentially, to get out of that basically chronic stress cycle that they might be in due to perhaps damage to the sympathetic nervous system, etc. So
I think it might be helpful to bring up here an idea called the window of tolerance, which is discussed by Dr. Dan Siegel, and his thought is more, based on, trauma and adverse childhood experiences and things like that have sort of damaged people's autonomic nervous system, and having either a hyper arousal, the higher sympathetic state, or a hypoarousal, and kind of finding that the window of tolerance there is kind of where you're just having this ebb and flow, like a nice steady parasympathetic sympathetic response, throughout the day. But when there is something, like trauma in somebody's life, and there's a lot of that in today's day and age, oftentimes people will be exposed to some sort of stimulus and they will skyrocket into this hyper arousal, hyper sympathetic response, and it's very difficult to come back down. So I'm wondering if this is sort of what you're talking about. So I would definitely look into Dr. Dan Siegel's work, and some of those things that were mentioned in the question are some of his recommendations. But one of the most basic things that he does recommend is, again, sort of the mindfulness on those 5 senses, and talking with somebody. It's obviously helpful if you're with them, I'm thinking of a kid, or, a spouse or something, or a friend. You can kind of talk with them. Okay, so what do you smell right now? Like, how are you feeling? Are you laying in bed? Are you feeling, comfortable? Kind of bringing them back into their body, so to speak, so that, and having them connect with the sensory stimulus around them is going to help bring them back in. And again, and he has strategies if someone can, it kind of goes the opposite. If they're in hypo, they kind of just freeze and everything really slows down. And so there's ways, he also has strategies specific for what, somebody's bent might be. So I don't know if that answers your question, but when I saw that come through, I thought that maybe that would be helpful for some of these people that do get stuck in parasympathetic or sympathetic state.
The other thing too, Ashley, and you can maybe talk to this better too, is, there are certainly people that are hyperadrenergic, they call it. So their sympathetic tone is big all the time. I think you're seeing a lot of people out there right now. Don't forget that the main neurotransmitter in the parasympathetic system is acetylcholine. And if you don't have enough choline in your diet, whole eggs and things, then maybe your acetylcholine is reduced and you don't have enough of that neurotransmitter to help make your parasympathetic nervous system counterbalance the sympathetic tone that you have as well. And then, yeah, you have to work on, recognizing that when my sympathetic nervous system is high, my heart rate is up, etc., work on ways to bring that down. That's where all the things that we just were talking about before too. Maybe I'm wrong. You tell me.
No, I think that's great. And I think it's important, even she mentioned functional medicine. I mean, looking at things like neurotransmitters, and do you have the raw materials for your neurotransmitters? We work a lot with that as well. So that was a good point.
I think that, one thing as well that I think of for most people in general is they're not really taking into consideration how many of these stressors might be really impacting them. And I do this with every autoimmune patient that I sit down with, and some of you watching may have seen me do this, whatever, so I'm going to apologize. But, if this is your body, I don't care what tissue it is that's being impacted right now, if it's your brain, if it's your gut, if it's your adrenal glands, if it's your skin, doesn't matter. If you take your other hand and you start scratching, how long are you going to want to do that? 6 seconds, 6 minutes, 6 years? How long? And the answer is not very long, because this is starting to get raw and red and irritated. And then the next question is well, is the body trying to heal it right now? Yeah, for sure. The body's trying to heal this skin right now as I'm scratching it. Is it going to be able to keep up with the healing process versus the scratching? Which one's going to win out? Obviously, the scratching is. And so I can put, that magical herb from some Tibetan cave or the best medication on it. I can kiss it all better. It's still not going to get better unless I pull this hand off. This hand has to come off. And we've got to be looking at the big stressors that are driving disease processes. And it's the bad foods that are, processed and not grown correctly, and on. Bad bugs, viruses, parasites, bacteria, fungi, yeast, and on and on and on. Bad food, bad bugs, environmental toxins, all the plastics and EMFs we'll talk about next week, and the chemicals that we're spraying, the personal care products that we're using, on and on. So environmental toxins, stress being more emotional stress, my relationships, my job sucks, my relationship with my parents is terrible right now, my kid doesn't like me, what's going on from an emotional stress standpoint, and then altered hormone function. Unfortunately, women, you guys carry the load for autoimmune disease, and there's a lot of hormone fluctuations that happen every month, let alone for other altered hormone function that can result for men and women as a result of endocrine disrupting chemicals that we come in contact with from the environmental toxin standpoint that we talked of, etc. But are we taking an honest look at all 5 kind of categories of stressors, if you will, and the cumulative burden that we're dealing with, and how that is then impacting the body and the ultimate sympathetic parasympathetic regulation? And for some people, it might be hard because we're stuck in a spot where I've done what I can to remove certain things, and certain ones remain because of certain family situations or work situations, school situations, etc. And that can be some really hard decisions that may need to be made or can sometimes have to be made for a short period of time to get the body to regulate again too for certain people. But I've had patients quit their jobs, and because that was such a toxic environment and situation for them, they had to get out of it. And you know what? They were able to start recovering as a result of it because it pulled off some of those fingers for them.
Let's not forget behavior. Like you said, behavior modification, changing your behavior. Let's not forget all the other wonderful toxins that we put into our body with alcohol and cigarette smoking and things like that stress your body that you just don't need to be doing. They're just an unnatural stressor as well too. So like you're saying, Kevin, let's modify behaviors. This job sucks and I need to go find a new job. Well, I know we need to have a paycheck, but you got to start thinking about what's important for you and what you're going to do long term. Okay. Oh, I can't stop smoking. Well, guess what? You're going to keep on having free radicals and other problems. You're going to have issues. So I can't agree more that there's other things,
Yeah. Any other questions that anybody has?
We're going long tonight.
We are going long. Sorry, everybody.
Yes.
People are trickling out as they want. So
there you go. All right. Awesome. Well, that was good. Thank you.
Yeah. Appreciate everybody coming. Once again,
Thanks,
next Thursday, 8:00, we're going to be talking about EMFs and the incredible health implications that come from that. There's a lot of physiology to be discussed, and there's a ton of research out there on it. So I'm excited to be sharing that with you all. Look forward to seeing you next week. Same time.